Hi, I'm Matses Gauthier. I'm a third-year student at Dawson College Physiotherapy Technology program. Today, I'll be here to talk about frozen shoulder and goniometry. So, what is a physiotech? So, as a physiotech, I am allowed to treat patients after receiving a referral from either a medical doctor or a physiotherapist. Now, where we're different from, physiotherapists is that we cannot diagnose. We need a referral to do any kind of treatment, simply put. Now, today we're talking about Sarah Lynn, who's a cancer patient who has frozen shoulder, where we come into play. Frozen shoulder is when the structures of the shoulder, joint, ligaments, muscle, are stiffened up, inflamed, and it creates a lot of pain, soreness, and trouble with moving. So what we'll be doing is a movement scan, so basically just looking at the movement of the shoulder, and this is important as it gives us an idea of how they need to recover or what they need to reach as we look at both shoulders, left and right, affected, unaffected. So we compare the affected side to the unaffected. Now to do this, we use a tool called a goniometer. It has two arms, it spins, it turns around, and so you have one stable arm and one movement arm. The stable arm will be put, you have the center point, which will be put on the joint, and you'll have the stable arm put along the joint, which will kind of dictate your zero angle. As you can see, it gives us a 360 degree of angle. So you'll put the on the joint across as your zero, and then while they do the movement, you'll use the movement arm to calculate the degrees of motion they have. This is how you will get your angle of motion, your degree of range of motion. Now, after doing both sides, you'll see that you have 2 degrees of motion that, you compare and you see the difference between the two, and that tells you what you need to reach to have a full done treatment. Now, not only do you do the movement on both sides, you also have to do them actively and passively. Actively will be the patient doing it themselves. So you'll just put the goniometer, they'll do the movement, and you'll follow them along. While passively, you will be doing the movement for them. So you will grab their arm, and you'll move the arm yourself to try and see what's the difference between their active and passive movement. Because oftentimes it will not be the same. There be muscle weakness, stiffness, or any other reason. Thank you for listening.